our patient community of patients to share stories with you. So we're going to welcome up to the stage some of our friends and colleagues and hear their stories. They will be facilitated by Ms. Barnes from the University of Texas MD Anderson Cancer Center and Ms. Feely, from Johns Hopkins University School of Medicine. So we'll welcome our panelists and our facilitators to the front.
So each patient will take about 10 minutes to tell you all their stories, and then we'll take the opportunity in between presenters to have a question and answer session so that you can recall the information that they've shared. Let's start with Mr. Bradley Crump.
Should we do it from here or from up there?
Wherever you have a microphone and you're comfortable.
Okay, this will work. Hindsight is a wonderful thing, particularly with Erdheim-Chester disease. In hindsight, I first started having symptoms in 2012. It started small. I couldn't lay on my stomach. And when I was reading in bed, I noticed I was getting some pain in my testicles. And I just figured this is what happens when you get old. And so I didn't do anything about it. I modified my behavior. By February of 2013, the pain had spread to my sides and back. The pain would come and go, so I tried to solve it myself. You know, people were talking about gluten allergies. I thought maybe I have that. Or a problem with dairy. Everything I could eliminate, I eliminated with no effect, and the pain continued to get worse. At some point, I couldn't take it anymore, so I went to the doctor. I don't mean I couldn't take the pain anymore. I couldn't take the pain of having my wife harass me. My doctor suggested a CT scan, and the insurance company said no. So I went to the ER and told them that I was in pain and waiting approval for a CT scan, and so they did it for me. By the way, I found this is a very effective way of beating insurance company denial letters. You should try it.
And attorneys.
After hours of, yes, they're annoying, aren't they? After hours of waiting for the results, I was told there was nothing life-threatening, so they would release me and I should follow up with my doctor. By the way, at that moment I had a blocked spleen, symptoms of pancreatic problems, and something horribly wrong in my abdomen. They didn't mention any of that. The pain was motivating me, so I went to my primary care physician, Dr. Clapholes, who loves a strange case and has a passion for helping patients. He ordered an endoscopic ultrasound, which was done in May. The doctor that did the test told me the day of the procedure he saw something on the tail of my pancreas, but that I would have to wait until the biopsy came in for more information. The next 2 weeks I spent pretending that I didn't think I had pancreatic cancer, that I wasn't likely to leave my wife without a husband, and my 4 children without a father. It was one of the lowest points of my life. The results ended up showing I didn't have pancreatic cancer, so my primary care physician called me in and had a talk with me about retroperitoneal fibrosis. He had been doing some reading and he thought it was possible that that's what I was experiencing. This was the day I realized that doctors are just guessing. True, those guesses are based on experience and knowledge and their educational experience, but they're not the magicians I had thought that they were. And that's scary. So I started to do my own research, and my wife did as well. We found a doctor at NYU and another at Johns Hopkins who were supposed to be the best with RPF. I scheduled appointments with both of them, but the doctor at NYU was able to see me first, so I went. I ended up having laparoscopic exploratory surgery a month later in June, and the results were interpreted as confirming my original diagnosis of retroperitoneal fibrosis. So I started taking high doses of prednisone, which is a really amazing drug that is horrible, if you ask me. During this time, I experienced untreated pain, uncontrollable rage, depression, and suicidal thoughts. It was during this period that Don Marie and I realized we would need to be our own best advocates. So we sought help with the pain and never really found any good answers. I started blogging to release the chaos from my mind, which some people found disturbing, but was very, very therapeutic for me. Eventually, the appointment I had with Dr. Sheila John Hopkins was approaching. I already had my diagnosis, but I thought I've always wanted to go down to Baltimore and catch a baseball game, so I went anyways. And Don Marie thought a second opinion would be a good idea, and I mentioned that she can nag you. So we went. Dr. Sheila walks into the room, draws me a little diagram with 3 circles on it, telling me the 3 types of things you can have if you have this type of diagnosis. And then he crosses off retroperitoneal fibrosis and says, I think you have Erdheim-Chester disease. I'm going to have to order some more tests on your biopsy slides and do some more scans to be sure, but don't look it up online until I confirm. So as soon as we got in the car, I Googled it. And we cried. 5 years average lifespan from diagnosis to death. Yeah. It was devastating. Eventually, the diagnosis was confirmed, and I started taking anakinra soon after that, which was very helpful. But I had little hope. After the first ECD Global Alliance conference in San Diego, I went to the NIH to see Dr. Estrada and his bulldog PA, Kevin O'Brien. That man does not have a thread that he does not pull on and pull on and pull on until he thinks he's at the end of the story. He's very good at what he does. While there, I learned lots of details about the disease process as it's manifested in me and much more, like my extremely low testosterone levels, the fact that I had high fecal fat, and that there was no medically clear reason why I was losing weight. I got down to 146 pounds at one point. At some point soon after that, I moved my care over to Dr. Diamond at Memorial Sloan Kettering for 2 reasons. First, he's closer to my home, which made him more accessible for all of the tests I needed to do. And second, we connect, and I think that that's really important. While being treated at Memorial Sloan Kettering, I noticed that my testicular density was changing. I told my wife I wouldn't say the word balls.
You just said it.
Oops. So I asked that we look into it, which resulted in a biopsy that showed I had Rose-Dorfman disease in my testes. Rose-Dorfman disease is a histiocyte disorder similar to ECD. In fact, gentlemen, most of you who have low testosterone might be dealing with something similar. So now I'm on testosterone injections, which have stabilized my mood and given me increased energy. I've also recently switched over to methotrexate since I'm taking a break from anakinra, which was wearing out my immune system. For all intents and purposes, I am better. Here's the thing, though. I'm not better. Better people don't study every set of blood work looking for things that are going to go wrong. Better people don't get blood work. Better people don't give themselves injections. They don't get scans. They don't worry about every new pain as a sign that things are starting to fall apart again. ECD is a monster, and it's here inside of me waiting so that 6 months from now, 12 months from now, 10 years from now, it can rear its ugly head again. And living with that knowledge, but not talking about it to people because they don't really want to hear that, is exhausting. And I think most of you know what I mean. And that's my story.
Anybody have any questions for Mr. Crump?
So one of the things I've started to do since being sick is I don't do things I don't want to do anymore. And one of the things I don't want to do is I don't want to sit up here while everyone else is talking. So I'm going to move down there if you don't have questions.
Go ahead.
How do you follow that?
Introduce yourself as well. I don't know everyone. I knew Mr. Crump. I didn't know everyone.
Okay. Well, my name is Vivian Dooley, and I hail all the way from Ireland. So, for all of those of you that don't know where Ireland is we're your next neighbour to the east. If you start swimming somewhere around Maine, when you make land, you should be in Ireland. So, I suppose it's a long way from the west coast of Ireland to, first of all, to the NIH, and secondly, to Houston. So I'm glad to be here. I really appreciate the invitation. I just want to thank Kathy and Jesse and all the gang that are down there for a really wonderful symposium that they put on here this weekend. I suppose a bit of background first. I was diagnosed on the very last day of August, Friday evening, 7:30, on the 31st of August 2012. And the reason why I remember the evening so well, it was a consultant endocrinologist that actually diagnosed me. He was at me for about probably 3 years at that stage, but I had symptoms going back for 5 years, having kidney surgery 5 years earlier. And he used to say, "You're my most important patient." And I said, "Why?" And he says, "It's because you're the only FFFer to come through the door that I don't know what's wrong with." So that's why he was so stuck in what was on. So he stuck with it all the way through until he eventually diagnosed me with Erdheim-Chester disease. And I think that's the key for a lot of people, is you need to meet that particular individual medical professional who will actually stick with you and keep going and keep going and keep going, and will eventually get there and find out what is wrong with you. I suppose the main problems I had prior to that was I had kidney problems, I had diabetes insipidus, I eventually got bone pain, I had some skin problems, and when presented the whole lot together, they eventually figured out that I had Erdheim-Chester. Previous diagnosis, I had everything from multiple myeloma put down my throat and that sort of stuff, all sorts of stuff that really were not very nice. And I suppose when he told me what was wrong with me, and he didn't tell me what it was, he says, "All I can tell you is this is what you have. I don't know an awful lot about it, so you're going to have to find out. I'll refer you to a oncologist who will tell you about it, a blood oncologist." And he says, "Well, considering what was in the bucket for you, all the diseases that were down that bucket, you didn't actually draw the worst of them, because it won't kill you immediately." So that was the only consolation that came my way at the time. So I eventually, just a month later, I was in Paris. I was with Dr. Harash and Jan Emilia, is that his name? The guy that does the BRAF mutations in France. And they confirmed that it was indeed Erdheim-Chester disease, and I was BRAF positive as well at the same time. So they recommended, as was the time, that we start straight away on Interferon. So I went on Interferon, and for me, Interferon was probably the most toxic substance I've ever taken in my life. Now, I don't know whether other people have had that experience or not, but for anyone that's trying to lose weight, it's a fantastic drug. I lost almost 40 pounds on Interferon in 9 months, so it was that severe. I had severe pain. I mean, very severe pain. I was on morphine patches, and morphine at the time, it was mainly in the long bones of my feet, but I had it in the arms and as well, and it was pretty unbearable. So then at the end of 2013, or just shortly after being diagnosed first in 2012, I managed to find Kathy and the ECD Global Alliance online. And I sent off an email to Kathy, and I got a reply back that said, congratulations on your diagnosis. And I thought, well, what sort of a header have I managed to come across now at this stage? Because congratulations on such a diagnosis. But then she went on to explain her situation and how she came to form the Alliance, and I understood exactly what she was talking about. It was just before the first ECD Global Alliance gathering in San Diego, and San Diego from where I am is approximately 7,000 miles, so it wasn't really realistic to go to San Diego. But I have a very determined daughter who decided we were going. And we ended up there. I met up with Juvene Estrada Veras, and I met up with Dr. Eli Diamond there, and they invited me to basically talk to them about trial of venirafenib that they were trying, and Dr. Estrada Veras convinced me to come to the NIH for the natural history study, and I went over there. And I was telling my own doctor, who was an blood oncologist, that I was actually going over there. And he said, well, there's a very exciting trial going to be opening in the NIH shortly. And I arrived into the NIH, and I said to Dr. Estrada, I said, I believe you're going to opening a trial. He said, how did you find that out? Because this was a full 14 months before the trial. They were only just talking about it at the time, but it came through GSK that they actually let it out. So I had heard that the trial was going to open there, or hopefully open there, and I held out as long as possible on the whole promise that basically I wasn't going to start venirafenib until I see whether or not they got the go-ahead for the trial or not. I didn't know whether I was going to be eligible. I didn't know whether, if I was eligible, was going to be successful or not, but I decided to wait. And I did wait until and I was emailing and contacting them and everything to see was there any progress on it. And it took, as any of you know about the trial in the NIH, it took a hell of a long time to get approval off the ground. I suppose in between that, I was put on anakinra. I found anakinra very, very good. It was a great drug for, especially for bone pain, for inflammation of the bones, and that's for the joints, and that did make a huge difference to me. I suppose the thing is when I got approval on the trial in February of this year in the NIH, and I was one of three. I see the other one of here, Bonnie down here, was another number 2. I was number 3, and a guy called Bobby was number 1. And we were the first 3 patients on this combined therapy, which is the MEK and BRAF inhibitors, so dabrafenib and trametinib. And we all got off to kind of a similar start, and that was that the doses were much too high for everybody. Very, very high temperatures and high blood pressures and all that went with it. But reducing the dose meant that we got settled into it. And I think I'm right, Bonnie, when I say we're all doing well. So we're doing well. And we've shown a significant reduction in lesions. Now, I'm conscious that I'm going a bit over the time, but just on the trial in the NIH itself is it's a grueling week. It's a grueling week for the natural history study. It's an even more grueling week when you have done it 7 weeks out of, I think it's 13 weeks I've been in the US since February, including the 3-week startup of the trial. And to go through all those scans first of all every month and then every 2 months since that has been a grueling challenge. And when you pile on a round trip of 7,500 miles on top of that in a week, it's a very, very grueling schedule. So I'm 50,000 miles in on this journey this year, so it has been a hell of a journey. But it's worth it. Every mile of it has been worth it. I see huge difference in my energy, in my mobility. I've left the cane in the room today, and I said I'm going to come to this conference today without the cane, even though I use a cane. But I have it left in the room, and it's all because of the fantastic care that we've been getting in the NIH. And while Bradley said, and he's very right, that Kevin O'Brien is a small bit of a tyrant, I'd say would be the nearest thing to put it. He's not even here to defend himself. He leaves absolutely nothing, I mean, out when he starts again. You will get away with nothing with Kevin O'Brien, including your paperwork. If you don't have your paperwork right when you come, he's like a headmaster when you meet him at the door, and he just basically goes there. So I suppose I'm there. The trial is to run until next January, and the big question for all of us is, okay, what then? And I was asking questions down here today, and I was basically saying, okay, how long did you stay on these drugs, or what is the situation? And I think, Philippe, you were intervened, said you don't know, or Julian was saying he doesn't know, or nobody knows what is the situation with these drugs. They're fantastic drugs for people that are on it. I believe the MEK inhibitor that I'm on as well, I see my good friend down there who's a testament to being on the MEK inhibitor, and I see there's trials opening on that for people that are not BRAF positive. And I'm very excited about that, and I think it's a fantastic thing for that. One other little thing that I said I would touch on while I have the thing is, and I'm conscious I'm probably gone over the time on you there, but there's a certain second side to the journey. The journey, everybody that's in here has been in the journey that has gone from doctor to medicines, to appointments, in and out all the time. But the second side, I think, to me, was probably the harder part of the journey. And that was the journey that I had to make inside myself. And I think you go from denial to anger to worry to all of the things that go through your head as regards, okay, what is this going to keep us for the future? It's one of the areas probably we're a bit slow to talk about, as basically it's the torture. It's, you know, the anxiety of it, the worry of it, the time you spend lying awake at night and dealing with the new reality that where you are and what you have to deal with and what that holds for you for the future, and trying to come to terms with that. We have a fantastic set of doctors today here. I mean, this lineup that was here today was just unbelievable. There's no other patient group anywhere with any disease anywhere that gets that sort of open access to the leading experts in the field that they're doing. This is unbelievable. But we need to also talk about the whole area of managing the side effects of it. And it's not side effects of medicine, it's the side effects of the disease. We need to open up more of that. To me, I found it almost impossible to accept help. I found I was a person who was incredibly independent. I've been working all my life, an electronic engineer all the time, keeping everything. My job was solving problems, was basically fixing problems. I was called in when someone else couldn't find the reason why something in electronics was not doing what it should do. And all of a sudden I was faced with a problem that was bigger than me, and I found it very hard to accept help. I found it very hard, you know, when people tried to help me. I mean, my good wife was here, tried to get me a pass that would allow me to park in a wheelchair space when I was going to the hospital appointments. I kept that out for a year and a half because I refused to get it, because I refused to be put in that box that was telling me that I was now in the situation that I was in. So that went through, and the only thing that kept me going was hope. And the hope of a cure, an improvement, to get back to where I was, to get something going there and that. But hope is very fragile, and it's very easy to be dashed. And I think with medical professionals, they reach and know that when they're dealing with people, is that this person could be hanging on to a very, very small string of hope. And you need to keep, it eases worries, it calms fears, it lifts the anxiety, all that, this string of hope. But it's so easy to dash it, like. And it's the words of Seamus Heaney, our famous poet in Ireland, said this, like, even if your hopes that you started out with are dashed, hope must be maintained. And it's so true, we have to maintain the hope. And that's what I'm here today. The one thing that you can do is the more you share hope, and I'm sharing my hope for the future with everyone. I'm so positive about where we're going from with these new drugs and with all the new therapies that are coming in and all the research that's going on. I'm sharing that hope with everybody here. And I think the only thing about hope is the more you share it, the more you end up with for yourself. And I'm sharing it with everybody here because I think that's what we all need to do. So believe the future shore is reachable from here. Believe in miracle and cures at healing wells. Thank you.
Oh, there's Kevin. There's Kevin at the door.
Kevin, I didn't say a thing about you.
Even comments in agreement or similar feelings would be fine too. Introduce yourself as well.
I'm Bonnie,
I'm Bonnie.
and I just wanted to say to Vivian, he is such an inspiration to me. I don't mean to get emotional, but when I first met him, he walked with a cane and he was shaken. He really looked bad, but now he's gained a little weight, and he just looks so good. And him and I together on this trial drug, together we talk to each other, and it's like we give encouragement to each other. But he is just remarkable. Thank you.
Anybody else?
When I was listening to your story, I was thinking about when you said your doctor told you not to Google it, and my experience was so different. When my surgeon told me about my disease, he just threw the papers on the counter and said, "You're a very rare young lady, look it up," and walked out the door. So mine was just so much traumatic, and so I know how you felt. I immediately looked it up, and I was terrified, but I'm glad yours told you not to look it up as opposed to mine, who told me to look it up.
Anybody else? Okay, let's proceed with Janet and introduce yourself, where you're from.
What? Okay. Vivian said he's going to wait with us, and we really appreciate that. Okay, so all of us here have a backstory, and I'm going to start with my backstory. My name is Janet Bunge, and my first identity began on October 19th, 1956, right across the street at St. Luke's Hospital. I was born the fourth of 5 daughters, and my sister was born 4 minutes later. So my second identity began when I was 5 years old. My father, at the age of 38, had a fatal heart attack over there at Herman Hospital. Some might say he was spared from female hormone poisoning. My third identity began somewhere during that time. I was a daughter of a bipolar mother. We were raised as free-range children. Of course, we didn't know that she was bipolar. We just thought that we drove her crazy. We were survivors, riding horses bareback, with many an emergency dismount, bicycling all over West Houston, and catching baby turtles in the lakes amongst the water moccasins. We tried to sell the turtles, not the snakes, to the neighbors. Very entrepreneurial, not profitable, weak market. We did have an unstable upbringing, but each of us graduated from a university here in Texas. And here I sit today in the city I grew up in. In college, I further developed my identity as a nurse. I made my way to Duke University Hospital, and I worked as a neonatal ICU RN, and actually got paid to take care of babies. There I met my future husband, a psychiatry resident, and I grabbed him fast. We just raised his hand. Hey, Bob. I spent a year volunteering in the Appalachian Hills in an area with one functioning traffic light and many functioning privies. After we married, we moved to Lexington, Kentucky, and I worked in another NICU, and Bob began a private practice. My next identity was motherhood. 2 daughters, 2 sons. My identity as a nurse has never been lost, because even when I quit getting paid, I was nurse to friends, to neighbors, to church, to children, and to the community. So what makes our identity? Is it our upbringing or what has happened to us that we can't control? Is it the career path we choose? Is it whether or not we marry or whether or not we move? Is it a disease like ECD or cancer that gives us identity? ECD, how did I get included in this party that none of us asked to be invited to? 12 years ago, in 2003, I felt a funny lump on the back of my thigh. A dermatologist excised it and sent it off to pathology. Many weeks later, it came back as this or that. Who knows what? But the name histiocyte was somewhere in there. About 4 years later, more bumps began to appear on my legs, and I went to a different dermatologist. Eventually, I was diagnosed with multicentric reticulohistiocytosis. About the time I learned how to say that word, I had a show and tell with a number of dermatologists from across Kentucky, and I was really on display at 2 different conferences. Then I was referred to Mayo in Rochester, Minnesota, with the working diagnosis of MRH. And I might add, as well as you know this, that a working diagnosis is really more distracting than no diagnosis at all. After a week there, I was given some meaningless diagnosis, but I really think that I was diagnosed as a whiny white woman. Sorry, guys. Okay, now I had already mentioned the beginnings of ataxia to doctors, and later in September of 2014, a friend said I was slurring my speech. Well, a heavy Texas drawl could have been the explanation. And don't get confused, Dr. Yanku does not have a heavy Texas drawl. Okay, but looking drunk was totally out of character for me. After a brain MRI and an LP, and I have no idea what the lesions in the cerebellum and brainstem could be by the local neurologist, who also went to Mayo, I asked to be referred to Duke, even though in Kentucky, Duke is a 4-letter word. Do you guys know why it's a 4-letter word? Okay, I won't explain. Okay, the Duke neurologist looked at the MRI and told me that he had never seen lesions like this before. Not a comforting statement. I returned to Duke anyway in January of 2015 to see not only the neurologist, but a rheumatologist who actually listened to me and ordered a simple x-ray of the femur. This is the first time a doctor had taken an x-ray of the femur rather than passing off the complaint as tendinitis or aging. Actually, his 27-year-old female resident was the first to even suggest ECD as she walked out the door. So, after 2 days of studying the lytic and sclerotic femur with a radiologist, the rheumatologist called me to drop this ECD bomb. For me, baffling brain lesions, long bone sclerosis, and skin histiocytes made for ECD. I referred myself to NIH after some computer sleuthing. And I know doctors just love computer sleuthing. The Duke doctor didn't need to find out about the BRAF gene. He didn't see the need to find out about the BRAF gene, but he was compelled to prescribe pegylated interferon alpha. And I had read enough from the NIH website to want further investigation to not only having a diagnosis of ECD, but whether or not I was BRAF positive, negative, or whatever. My son, the attorney, put it this way: Mom, I think he had the thrill of the diagnosis, but he does not have the thrill to treat you. Thank God for the ECD Global Alliance, Kevin O'Brien, Kevin, are you in here still?
Gone again.
Gone again, okay. And it's going to be nice to him, too. Okay, and Dr. Stradaveras at NIH. It's been a godsend to be able to interact via the internet with other patients and family members. Dr. Stradaveras got on the phone. He had multiple slides from previous skin biopsies mailed to him, and he grew out the positive BRAF V600E mutation. I don't know if you use the word grew, but that's what I'm using. Okay, I entered the history study, and I was a candidate for the same phase 2 drug trial that Vivian and Bonnie are on, but I spent a week there in April, but I missed the trial by 2 millimeters. But I did just meet wonderful people at NIH, and they all passed the NICE test. I came home to a private oncologist who was up for the ECD challenge, and she was also up for the challenge of me, even though my brain lesions were, as the nerdy neurologist at NIH said. You guys know the nerdy neurologist is funny? Okay, so he said, those lesions are not in suburbia, they are downtown. So I had to think about that. Okay, they're not in the outfield, they're in the infield. Okay, so Dr. Harper has me on. You're just getting it? Come on.
I haven't got it yet.
You haven't got it yet? Okay, never mind. Okay, Dr. Harper, who's my oncologist in Lexington, has me on the V drug 3+3 because I reacted immediately to 4+4, and I've been taking it since the middle of May. So is this my new identity? Do I now describe myself as one of the less than 300 in America that have been diagnosed with this rare disease? And will I always be on a kinase inhibitor and feel less than I've always felt? And will I ever work again? By the way, my oncologist told me in the beginning of May, you are not allowed to drive. I'm still trying to figure that out. Okay, what about these new symptoms? What about my shoulder pain? What about tremors? What about my erratic blood pressure? My name is Janet Bunge, and my identity is first and foremost as a child of the King. Yes, I was one of 5 girls. I was fatherless. I was being raised by a very unstable mother. But nothing can impact my identity as a child of God. I belong to ECD, a group for which no one applies to join. I thank God, though, for the ECD Global Alliance, giving us to each other for friendship, for support, and for knowledge. Our disease does not define our identity, because we are far more than ECD. Thank you.
Can you hear okay? And now you can. I think I'm breaking these. Each one we keep having to change. Any questions or comments? Anyone? Okay, then we'll continue on with Alice.
Okay.
Do you want to bring
I've actually made a presentation, so let's see. To get that overachiever, she says. I had this presentation at work last month, just to give it a trial. But you sent it, yeah. But I had some extra things on my pen. Because I wanted to show some video clips too.
Oh, on your pen?
Yeah. So maybe I could just open my pen. There it is. Okay.
Click the, get rid of that button thing. There's a mouse if you want to use it. There we go. Now, click right there.
Where?
Well, that little screen thing right there. No. On the orange line. On the orange line. That one. There we go.
Oh, okay. My name is, can everyone hear me? My name is Alice Nilsson, and I come from Yeah. I come from Norway. And I'm going to tell you a little bit about my journey and how do I move forward. Here we go.
Do you want this?
No, I got it. I am 36 years old now. I had a normal childhood. I started to fall a lot in my 20s. And oh, okay, sorry. It wasn't until the fall of 2005 I had my first CT and MRI because I'd gone to my primary doctor and was complaining I was falling and not able to pick up my feet. And we have many different dialects in Norway, so he was just kind of, I was saying I was stumbling, and he was saying, oh, that's a different dialect in the place that I was living then, and it wasn't taken seriously until 2005. They found something on my CT and then my MRI. It wasn't until February 2011 I was diagnosed. It was a long journey. I went to 3 different hospitals, many doctors. I had countless MRIs, biopsies, PET scans, you name it. The doctors practically gave up, calling it an unspecified neurological disease, because my symptoms were of, as I said, stumbling a lot. I had bad balance. My legs were stiff. I was dizzy. I was peeing and drinking nonstop. I eventually got referred to a hospital in Bergen. I was admitted there for 2 weeks. In December of 2010, I took the same tests as I had taken before. After those 2 weeks, the doctor already had a suspicion that it might be Erdheim-Chester. He said he had started reading in the back of the medical book. A bone biopsy gave the answer, which was taken because I have a lesion or tumor in my spine. I started on Interferon. That didn't really have any effect at all. It just made me tired. I received Botox in my legs because they were so stiff, but that didn't help either. Quickly after my diagnosis, I think I wrote Kathy. Where are you? There you are. Yeah, I wrote Kathy an email. I guess there were numerous emails right after that. There were lots of knowledgeable people there. Norway, they knew so little. And I eventually got in contact with Dr. Estrada too, all by myself. And I went to the NIH the fall of 2011 and then went back the fall of 2012. And I am BRAF positive. I had heard about this gene and the new medicine through the Global Alliance. I think I sent an email to Dr. Estrada and was told I just needed to get a biopsy to test for it, or they already had done the biopsy, so they just needed to test it. So, but it only took 9 months until they could figure out if they could do this biopsy in Norway, or if they didn't want to send it to the United States, and yeah. But the when they finally took the test in Norway, the answer came back quickly. I was positive. I started on 2+2, and I had enormous joint pain. I couldn't get out of bed in the morning. And after 3 weeks, I reduced to 1 in the morning and 2 at night. And after my first month, the checkup, I remember my neurologist, he was so excited, oh my God, there's change on your MRI. And the change was, the lesion in my spine was, I think it was like 12 millimeters, and it had shrunk a little bit. It had shrunk to 9 millimeters. So from 2011 to 2013, my walking had gotten much worse. I could only walk around 500 meters with walking sticks. My life in a wheelchair was getting closer. I was losing lots of strength. And after Vemurafenib, I think the day after I came back from my first month checkup at the hospital, I joined a gym again. I did lots of walking on the treadmill. I went from 1 kilometers, became to 2 and 3 and 4, and now I can do, I think I've been up to 10 or something. I started lifting weights. My 3-month checkup was even better. And after 6 months, the lesion in my spine was almost normalized, and it's now only scar tissue. But I understand that the scar tissue will always give me my stiff legs. But I have found exercise as my my second medicine. So I'm quite dependent on exercise. I go to physical therapist once or twice a week. I have 2 different ones. I have a personal trainer at the gym where I work out with 1 or 2 times a week, or sometimes even more. I work out at the gym on my own almost daily, sometimes before work and then after work. I go on walks with my walking sticks, and the past couple of weeks I've been trying to divorce my walking sticks, not to become dependent on them. Yeah. And I also sometimes do warm water exercises. The more exercise I get, the better I feel. And I'm so much better than I was last year, but I don't think you noticed, because the long plane ride from Norway and sitting all day at the conference is not good for me. So, yeah. So I can't sit more than an hour. My legs stiffen. So exercise is my new way of life, not just because it's a healthy way of life, but it's much needed. And I would not be where I am today without hard workouts and walks and not giving up. It motivates me because I see small differences to the better continuously. This was a trip, 380 meters up. It was like a rocky path up. This was another top in my hometown, 3 kilometers. That's me and my personal trainer. That's the Pulpit Rock. I don't know if you've heard of that in Norway. That was 680 meters up. Do I have time for, what time is it? Because I have some video things from me walking before I started. I'll just show a couple seconds. And this is not coming up on the screen. Why not? It's playing here, but not there.
We can see it.
We can see it.
Yeah.
Got these
While she's trying to pull that up, I just want to say that I really admire her tenacity and how
Yeah.
she persevered through trying to find a diagnosis, and it took a long time, many years. And I'm guessing that most of you had the same kind of issue, that it took a very long time to get a diagnosis.
Yeah.
Yes, raise your hand if that was your.
I'm
Yeah.
glad.
So
Turn
while
it
she's
around.
getting, she's pulling that up. Then afterwards, I'll come out with you and tell me how long it took. And it takes a lot of energy to keep going and keep going and trying to get people to listen to you.
But you get, yeah. It's this is sideways though, but you see me with walking. This is the 6-minute walking test. So, and I had to use the walking sticks, and I took one in September. Let's see. Okay. And there's, oh, my legs are kind of going wrong way, but yeah. At least now I'm walking on my own. I've even tried to jog. Yeah. And there's me on the bozo doing squats. Yeah. Okay, so hoping that I've spread some inspiration to everyone.
I'm really impressed with the bozo ball because I can't do that, and I don't have Erdheim-Chester disease, so that's really impressive. Again, I don't know if you heard me, but I really admire how you kept going to get a diagnosis, and it must have been a very frustrating thing to have been going through that for so many years and not getting a diagnosis. And I was saying that I don't think that that's unique to you. My guess is that most of you here have had that kind of problem where you had to continually search to try and find a diagnosis. Is that true? Yes. Yeah, raise your hands. Yeah. So some of you raise your hands and tell me like how long it took you to get diagnosed. Volunteers? No? Yes? Okay.
Well, my first signs started in 2010, and I wasn't diagnosed until 2014. So.
Someone else?
right here. Can I talk for her? She's shy.
You can.
2008, it was, I remember it was October 3rd, and she actually had serosities, very large amounts of fluid on her abdomen. So we went into Olmsted Medical, which is in Rochester. It's the other hospital in town, what no one hears about, because Mayo's the big gun. And they couldn't help her. They said it was cancer, so they emergency ambulance threw over, and they came in, and that's when we started the process. Would have been October 3rd of 2008. And it took 3 years, and I've not got the number, but it was close to $2.5 million in tests and alternative medicine. We've been to Florida, Indiana, Michigan, Ohio, South Dakota to look at, you name it. We've done prolotherapy, we've done IV, chelation, and finally in 11, a doctor at Mayo was the one that diagnosed her, and took us till last year to be able to get her to Barnes Jewish Hospital, where she actually finally got on the trial down there. A little longer than I wanted, but that gives you the history.
Yeah, that's a long time. And the other thing that Alice touched on was the role of exercise and how that helped with her strength and her balance and her walking. And I think that that's kind of a theme. And Nancy's actually doing a presentation on that tomorrow. How many of you have like a regular exercise routine that you have to help? And physical therapy or, yeah. So Nancy's going to talk about that. We found that to be a very successful thing. Questions for the panel? Something you want to share? We have just a few more minutes.
You know, I didn't have to spend too much time at all. The first time I went to the doctor till a diagnosis was 3 months. I guess I was very fortunate. I was on a canoe trip in the Boundary Waters, and I tore up a meniscus on my knee, and I hobbled home, and I had an x-ray taken, and my doctor that looked at the x-rays, she says, I think there's something there I don't understand. So she sent me to the hematologist in our town, which is a very small, 30,000 people, and he didn't have any idea what he was looking at. He suggested that we wait 6 months and take a look at it again. And I says, you don't know what it is and you want me to wait 6 months? I said, no. So I went to Mayo Rochester, and they found it right away.
Anyone else?
Sorry there, I didn't get your name. Sorry.
My name's Tammy.
I just want to join with the tributes paid to Alice. I met Alice for the very first time in San Diego 2 years ago. And she was a very different person then than she is now. And her courage, and anyone that has seen her progress on Facebook as she went through all of these trials that she has gone through and her build-up over the last 2 years couldn't but be amazed at her endurance and, you know, stubbornness as regards you weren't going to give up. So I'd like to pay tribute to her this evening as well.
I think we have one more. Someone?
Alice, I would like to thank you for your motivation on exercise and hope that somebody over here listens to it and sees what you can do. And even though it's hard, you have to do it and you have to work at it, and you'll see the benefits from it. And I applaud you for that.
Yeah, thanks. Because it's a lot of hard work, and yeah, and sometimes sometimes I can be tired and don't want to, but it's like, oh, I have to go. I have to. So, yeah.
Thank you very much for your stories and the courage to tell your stories for the panel participants. And thank you all very much. Do you have an announcement?
Yeah, we'd like to thank the both of you for coming and helping out. This has been wonderful. Do you have any more comments? No?
Well, you'll be seeing us again tomorrow.
There you go. Well, thank you to our presenters. And we appreciate Ms. Barnes and Ms. Feely. And now just one quick announcement about tomorrow.